Thank you for joining us today. We'll just give it a minute more. Thank you for adding good to see all these folks in the chat. Thank you for joining us today. I think you're going to get some really useful information because I've had the pleasure of hearing a version of this presentation at our partner meeting, and it was just great. All right, well, we have a lot to cover and we only have an hour today, so I will get us started here. But again, you will all be getting the slides and the recording by the end of the week. So just a little bit about the network for those of you who are new to us. For those of you who are familiar with us, this is going to be redundant, but bear with me. We at Generations United have been working on behalf of grandparents and other relatives raising children for 25 years. And about 2.5 years ago, we were awarded a cooperative agreement from the Administration for Community Living to build and manage the first ever federally funded technical assistance center on the families. And when I say grandfamilies and kinship families, we use those terms interchangeably to mean grandparents, other relatives, and close family friends who raise children when parents can't. So grandfamilies does not have a more narrow meaning than kinship for us. Our purpose is to provide technical assistance to the array of state systems and tribal systems and territorial systems that you see in that network umbrella on the right. So those are all government agencies, but we also support nonprofits working in those areas and kinship navigators. So if you're trying to help kin, we're here to try to help you. We don't serve the families directly because communities do that best. The laws, the programs, the policies, they so much vary depending on where you have the luck or not luck of living as a kinship caregiver. So what we can do at the technical assistance is really elevate exemplary practices, promising practices. We make connections and we have learning opportunities like today's webinar. So these are a few of the things we do. And please know that we respond to individual requests for help. So if you're a new area agency you're an area agency on aging wanting to start a new program for kinship, send us, fill that form out there on the right, and we will get back to you. You want to develop grandfamilies housing, fill that form out, we'll get back to you. So all of that is free of charge. In addition, we're launching some learning collaboratives this year, some learning communities, in addition to monthly webinars, which we will continue to do. And then our website, which has a lot of resources on it and more every day. We probably put out an average of 3 to 4 new written resources a month. So it's, and you can access them there at the tab that says Resource Library. So, and you don't have to sign up to download anything. It should be very easy. And if it's not, please let us know. So data requests. So in terms of individual technical assistance requests, we have 2 technical assistance specialists here at the network, Kylie Craggett and Shayla Bottoms, who are at the ready to answer requests. And we get, like I said, an array of them. Many of the requests that we get are around data and how, what data is out there and what's not out there. And if they don't have the answer, they are able to reach out to we have 5 national partners, including Child Trends, who you're going to hear from today, and an array of subject matter experts. So we really have a lot of people that we can tap to answer your questions. But these are some examples of the kinds of questions that we have received over the last 2 years plus. A lot of questions about community-specific data. So how many kinship families are in my city? How many of them are not involved with child welfare, or what many people call informal families? It's a bit of a misnomer because many of those informal families have some kind of court-ordered legal custody or adoption. So for attorneys, it's hard to call those families informal, but that's kind of what's meant by many, is that they're not child welfare system involved. And it is often much harder to find data on those, but Brittany is going to tell you how. The percentage of caregivers who are victim kin, that's a harder number to get, but we have some idea of that. We get we've gotten several requests about which of these kinship families that are primarily quote unquote informal have legal relationships and what are they? And that is a very tricky one, but an area where we can make some progress. And then we get questions for a lot of child welfare specific data as well, which is a more defined population. So in general, there's more accessible data, but it has its limitations as well. And we get these data requests for a lot of reasons. Often, for a funding request, you need to, the person wants data to spell out the need, to make the case for the need in that community. We get data requests where the jurisdiction may know we think we have a lot of kinship caregivers in one county. So we need data to show that so that we can target our services there. Or maybe it's data to find out more about needs so that they can respond and tailor their services and supports. And sometimes it's about advocating for more funding or advocating for more services and more thoughtfulness around the policies and programs that support these families or try to. So that's just kind of a sampling of the kind of data requests that we get here at the National Technical Assistance Center. This is a landing page that we have on our website, and we wanted to highlight it because it has many of, it's kind of a non-data person's guide to where the big national sources of data are for kinship and grand families. So the U.S. Census Bureau sources, the Annie E. Casey Foundation sources, and the AFGARS, which is the National Database for Child Welfare Data. So this it scrolls well down, and you'll see a variety of links and things that should be of help, I hope. Also wanting to elevate, and Brittany's going to talk a little bit more about this, but there is a youth risk behavior survey that is conducted by the CDC in middle schools and high schools. Well, it's managed by the CDC. It's conducted by states, and it is and territories, and it is given to middle school and high school aged children. And Washington State has just added a couple of questions to it. It's a very extensive survey, but by adding these questions like, do you live with a kinship caregiver, or who do you live with? Then all this massive amounts of health and risk and behavior data can be downloaded from that. So it's a simple thing to do. Well, it should be. And this resource will share a practice of how to do that so that there's more data on youth that are raised in kinship families. And then please sign up for a monthly newsletter. This month's goes out on Thursday. And also, please follow the network on LinkedIn. We have a new LinkedIn page, and we share a lot of resources and news on that LinkedIn page throughout the weeks. So you will get the latest and greatest that way. And it is now my pleasure to turn over the webinar to Brittany Mihalik-Atkins from Child Trends, and Norma Hatfield, who is a Generations United Grand Voice and a kinship advocate par excellence in Kentucky. So turning it over to you all.
Thank you so much, Anna. My name is Brittany Mihalik-Atkins. I'm a research scientist at Child Trends in the child welfare area, and also former foster youth. So, and I was in foster care in Indiana, both, non-relative and kinship foster placement. So this topic is really near to my heart, and I'm glad to welcome my colleague and good friend, Norma Hatfield. Norma, do you want to introduce yourself?
Yeah, thank you. So as mentioned, my name is Norma Hatfield, and I am with Generations United's Grand Voice Network. I'm also president of the Kinship Families Coalition of Kentucky. I've been raising 2 of my grandchildren for almost 10 years now. And I gotta say, I was super excited to be invited to use my voice as in part of this presentation, because I really, really think that we need more data and we need to look at the issues more. Just very briefly, when I first started doing some advocacy in my state on kinship care, I met with the legislator, didn't know any better about, trying to gather data, things. I thought I could go share the story and something would get done. And the first question out of his mouth was, well, how much is this going to cost? And how many people are we talking about? And I didn't have the answer. And that's why I get excited when we start talking about gathering this kind of data, because that's how you fix problems. That's how you can make things better, because you understand them and you understand the needs. So thank you again for letting me be part of this.
Thank you so much. So we're going to walk through a really brief presentation, kind of giving an overview of an effort that Child Trends and the network partnered on to find data sources that can help us learn more about kinship and grandfamilies. So I'll give a quick overview, and then Norma will have some insights on each of our slides. So I think with that, we can go ahead and get started with our first presentation slide. Thank you so much. So here, just kind of giving some examples of where we can look for data on kinship and grandfamily. So of course, we start with some of the sources that folks have looked to for years. So large population surveys, like Anna mentioned, so the US Census, which has, the big every 10 years census, but also annual surveys, smaller sampling of different cities and populations in the US on different topics. We can also look at child welfare system administrative data. So the AFCARS, Adoption and Foster Care Analysis and Reporting System, I think AFCARS, and then NCANS, which is the federal, it's states reporting their data on child maltreatment, child protective services reports and such to the federal government. We can also look at child welfare system studies. So the National Survey of Child and Adolescent Wellbeing, or NSCAW. These are studies that are done, maybe by researchers, funded often by federal agencies. Big multi-year, let's follow families and children over time and see how they're doing during and after child welfare system involvement. Some of those studies have variables, data, the information we need to understand, are these children placed with grandfamilies, kinship caregivers? And if so, can we learn about those children, learn about their caregivers, kind of how they're doing and what they need? So that's another place that we, kind of look for data here I mentioned our prior work together on this topic. And then we can also look at child well-being studies. So as Anna mentioned, the Youth Risk Behavior Survey done or administered by the CDC and through states and school settings, that's going to be huge to kind of really learn, more about how kids are doing in kinship and grandfamilies compared to other settings. And maybe, hopefully there are lessons learned in Washington that can be applied to other states. And then also health and aging studies. So these are studies that, like maybe the Health and Retirement Study, or MIDAS, that's the midlife in the US study. So it's a big longitudinal study trying to understand aging, midlife, and later life in the US, health, well-being, relationships. And, but again, by just adding a couple of questions in, like, oh, are you raising a grandchild, or do you have children, living with you that that you're caring for? We can kind of learn more about kinship caregivers and grandparent caregivers that way. So yeah, those are some of the data sources we'll be talking about. And then the next few slides I'll go into, kind of what I think we can accomplish by finding and combining some unique data sources. Norma, do you have anything on this slide?
I just see that some folks are starting to put down ideas, in some areas as well. And so if anybody has any other thoughts on this, or any other sources, please share them in the chat.
Thank you. All right, so ready for our next slide, which is a pretty quick one. So yeah, just a few highlights of things we can accomplish by finding and combining data sources. The next slide, please. So the first thing is understanding the impacts of kinship caregiving on child and caregiver well-being. So in looking through lots of different data sources, research studies that have been published using the data sources that we just covered in the last couple slides. We can learn things like, Black grandparents raising grandchildren might face increased levels of frailty over time, particularly in low-income households. So there might be, something for folks to think about, that maybe certain caregivers are going to need additional, physical health related supports and services. That might not be something that child welfare system, caseworkers or something think about initially when they think about providing foster care or child welfare services. We also learned that, especially when first assuming caregiving responsibilities, grandparent caregivers are at increased risk for depressive symptoms. A lot of these studies that we were able to use to kind of learn a little bit about kinship and grandfamilies weren't designed for this purpose. There hasn't been a huge, national study that's just for this purpose. And so a lot of times we don't maybe have the information on caregivers and how well they were doing before they took on the caregiving responsibility. So in these big child welfare studies, for example, the first time we're getting information from a grandparent caregiver is when they become a caregiver, because the study is really about child welfare system involvement. I think that's really one of the big benefits of using health and aging related studies, is that maybe there is information that's being collected maybe halfway through the study this, someone assumes care of a grandchild, and then we have this kind of before, during, and maybe after. So that could be really important. We also learned that closer relationships with grandparent caregivers can lead to improved, mental health for both caregivers and children over several years. Closer relationships meaning youth and caregiver reports of how close they feel, the quality of the relationship between the caregiver and the child. And then we can also learn things like in 2022, 18% of grandparent caregivers had incomes below the federal poverty level. And that's compared with 12% of all grandparents who were living with grandchildren. So we know that there might be an increase in the risk of living at or below the poverty level if you're a grandparent who's caring for grandchildren. Again, don't have as much information on whether or not assuming care causes folks, to dip below the poverty level. But I think these data sets will really benefit from hearing from folks like Norma, who can say, okay, here are these initial data points. And we, researchers might say like, I wonder what's going on there. And then, talking with folks that have actually experienced it, they can say like, oh, I can probably tell you what's going on here. And those are the kind of things that will hopefully help inform the development of these, big studies that really are designed to kind of get at this. But in the meantime, I think, combining these data snapshots with perspectives from, grandparents like Norma can really help us get a really good picture. So I'll pass it over to Norma for some reflections on this slide.
Yeah, it's interesting when, personally, I know how I feel. I know what I've gone through. And sometimes you feel like you're very alone when you are that, a grandparent as an example that's taking care of kids, because you're dealing with so many things that are going on. And it feels good when you see some of these data points, if you will, because it validates the things that you've been feeling as a caregiver. And to me, it's, well, then there's hope that we can look at how we can make this better, as I mentioned earlier. But when I've talked to thousands of other caregivers in Kentucky as well, and when I look at the fact, talking about increased risk for depressive symptoms, absolutely. You got to stop and think, when you're taking in the children, you're dealing with the event itself where the children were removed. Is there also a criminal case that might be going on with an adult son or daughter, or someone that and you're dealing with all of the things around the children itself. And if you're a working grandparent, as an example, you're having to balance that. Your life is totally upset, from what you thought you were going to do. And so you got to find time yourself to process those emotions, and you have a lot on your plate. And sometimes I think you wonder, am I really going to get through all of this? And am I going to do a good job for the kids? But the kids are always better. I think we know that, being with a family person, somebody in the family, somebody that they feel very secure, family friend, and the kids in themselves, themselves are going to do better. One of my grandchildren, we had a lot of issues afterwards. I couldn't walk her into school and leave her alone without her breaking down. And it took a little while for that. But in general, she did really well. She flourished really well in school. We've gotten through some of those things, and she felt more safe with me than she did in foster care. And because she was in foster care first. And not to say that foster homes, they're bad. It's just, we know children are going to do better, and they're going to feel safer and more secure when they're with somebody. And as far as the poverty level, I saw this and I thought, well, of course. But what a lot of people don't realize when you think about kinship families or evicted kin families is that they have in their mind how much money they've put away for themselves, or their spouse, as an example. And then when you take in a family of 4 kids, 5 kids, whatever that might be, that does an impact. It does change the dynamics. And, again, I think that this kind of data is an argument for why we need more services out there and more supports.
Thank you so much. See how Norma chiming in makes this all so much more interesting and real. Thank you, Norma. Next slide, please. So another thing we can accomplish with, kind of combining these different unique data sources to learn about grandfamilies is to really dive into maybe unique or really specific topics of interest. So one thing that we had talked about in our partnership between Child Trends and the network in the past was growing interest in the numbers and needs of younger kinship caregivers. So even among grandparents, grandparent caregivers are considerably older now than they were maybe 10 years ago. And so that, I mean, makes sense in some ways because we know that, baby boomer generation, they're grandparents right now. So that, some of these things make sense. Generally, the US, it's trending toward population being older, but it is something to think about in terms of, again, like adjusting services, identifying specific just needs or resources for folks that maybe, more physical health related things that maybe aren't top of mind for folks who are usually, used to working with foster parents or parents and not as used to working with kinship caregivers or grandparents in particular. And then among younger kinship caregivers, there are unique needs. So things related to education or career development, financial stress, parenting. I think, if you think about maybe a 23-year-old taking on, a niece or nephew or a younger sibling, that person doesn't have, some of the stress that Norma was just saying in terms of thinking about saving for retirement or having money put away, but they were just starting their career. And so how do you kind of think about what's different in terms of supporting that person? So it's not, kind of a one size fits all thing. And then this is next up, just because it's a topic that we're going to keep thinking about more, but a really good idea I think that came from Anna and Melissa at the network is to think about kinship caregivers who are sandwiched between caring for both, the children that have come into their care, but also maybe an aging relative or parent. So in the context of parenting, there's literature on, the sandwiched generation. So folks that are maybe caring for their parents and their own children, but there's also this unique situation where you have folks in that position as a kinship caregiver. And so that, really being something that we have to think about. And I know that Norma will have thoughts on this slide too.
Oh, yeah. So one, I'm really excited about the fact that we're going to get more data long-term about being sandwiched, the sandwich generation, because that is absolutely true. I know for myself, especially also looking at the age of caregivers. I had just turned 52. And when I first got my grandkids placed with me, and it's almost been 10 years. And what I'm finding, well, in that particular case, I also had elderly parents. And for me, I was dealing with about a 5-year window of both of them, with a lot of illnesses being on hospice care until they passed. So I was dealing with courts. I was trying to take care of the kids and all the things that go with that. Plus, I'm also trying to take care of my parents as they're in the last stages of their life. And it's really challenging and it's really hard. And I'm looking forward to seeing more information on this, as the study goes along. And the same thing, as far as caregivers, what's interesting is, like I mentioned, I was 52. And so it's been almost 10 years later, but I'm meeting more siblings that are taking care of their kids. Also, I think it's looking at as we get older, sometimes the choice, has to be made. Where exactly is the best place? And it's really challenging as far as who's available for those kids. And so again, I think looking at some of that data is really important.
Thank you. If we can move to the next slide, please. Thank you so much. So another thing we can accomplish is to identify specific needs and barriers to services. So we learned using data from the National Survey of Children's Health, another big national child well-being study, that grandparents raising grandchildren are about twice as likely as parents who are raising children to have military service. Some of that makes sense in terms of thinking about generations of folks that have been in different, international conflicts. But also I think kind of points maybe to an additional point of intervention or additional partner. So like perhaps, with Veterans Affairs, how involved is the VA in different communities in terms of connecting grandparent caregivers, kinship caregivers to additional resources. That might be one place to kind of meet folks where they are. Another thing we've learned from this is the National Survey of Child and Adolescent Wellbeing data is that young children in kinship care may be less likely to receive early intervention and special education services than children in non-relative foster care. I think some of this is just related to these placements being what some folks, as Anna would say, would refer to as formal or informal, court-ordered versus not. So some of that might be that, automatic, with foster care, there are different processes in place. But it also could be that who's going to grandma and saying, here's exactly how you navigate these different education system processes for identifying different potential services in schools. You know, maybe it's been a while since they've had a kid in school, and so just kind of figuring out those things for folks. This next bit comes from research from my boss, actually, Dr. Teresa Washington, who I know is on this call somewhere. But her research in North Carolina, combining data from the child welfare system and the education system, found that children in kinship care fare way better on standardized tests in both math and reading than children in non-relative foster care. And when the right, you know, services were in place and supports are in place, children in kinship care can, you know, be performing in these standardized tests on par with kids in the general population, kids not in foster care, kids living with their parents. So I think that's huge, just because we know, and there's a lot of research on how children in you know, all different types of foster placements or out of home placements might struggle in education specifically. And these standardized tests can be really impactful in terms of, you know, are they going on to the next grade? And so I think that, you know, that's really huge to kind of learn that with the right supports in place, kids in kinship homes, you know, in kinship families can, you know, be achieving just as well as their peers are and where they're expected to be for their grade level. So that's huge. We also know that children in kinship care are less likely to have mental health disorders, diagnoses, and less likely to use mental health services than children in non-kinship care. I think, and that's from a meta-analysis, so combining the results of lots of different research studies together. So that finding is comparing data from over 667,000 children from 102 different studies. So that's a really cool way to combine data as well, to kind of think about all the studies that have been done. And there's some, you know, I think fancy statistical math, you know, that you can use to kind of combine what we know from all these different studies and look at these big trends like that. So again, as Norma said, a lot of times, you know, kids are going to do better. Like, you know, her granddaughter felt safer with her than in a foster home. And so having grandma there, you know, really is good for kids' mental health. And I think the data, you know, that pans out in the data. We also learned that over 1 in 4 grandparent caregivers report having a disability. And that's not just older grandparent caregivers. So nearly 22% of grandparent caregivers under 60 are also reporting having a disability. So again, thinking about other points of kind of meeting folks where they are, connecting maybe, you know, kinship care supports with disability or, you know, daily living support services. And also in 2022, data from the census say that half of children in grand families received some form of public assistance in the prior 12 months. Have to do a little bit more investigating to see how many of those families maybe that aren't represented in that half were missing out on services and supports that they were eligible for. But again, this is one of the things where we can kind of talk to folks that have this lived experience and learn, okay, maybe, you know, what's going on here, what might folks need, what are the specific supports and barriers to getting them. So Norma, again, I know you'll have lots of good insights on these.
Yeah, you know, when you think about the statistics as far as children are going to do better, they're going to learn better in kinship care. They're going to feel calmer. They're going to feel more secure. They're going to feel more safe. They're going to feel more focused, and it's just less trauma, I think, overall. One of my grandchildren that when she came to us, and we went to the school to kind of see what was going on with them, so we knew where that baseline was. And this child had already failed a grade, was about to fail another grade, was on an intervention plan, and pretty much was about to fail again. And it took us a lot of time, intentional time, and focus to get the right tutoring, to get all of the things that need in place. And now she's an honor roll student. And you know, they just need that safe, secure environment where then they can open up their mind and they can learn and have the support services that can be available. And really, when you look at all of these, to me, it just goes back to, we need more services. We need more financial support for kinship families and fictive kin families that step up to take these kids so that we can do the best that we can for the children. I mean, this data here, that's exactly what this all says. We need to get these barriers out of the way. We need to get these things in place, and the children have to be a priority.
Thank you. All right, if we can move to our next slide, we have one more quick overview of things we can do with these different data sources. So one single data source might not always have all the different information necessary to learn about a particular issue or to answer a particular question. So in these cases, we can think about ways to kind of piece things together. So to get different snippets of data from different data sources, and then to kind of, think about these things in combination to learn maybe about a trend. So the example here is thinking about co-occurring trends between substance use trends in the population, and then grandfamilies, the number of grandfamilies in the population. So in 1970, under 1 million children lived with a grandparent as a primary caregiver, and that was up to 1.6 million in 2014, and then 2.5 million by 2022. So those data come from the census. And we also know between 2002 and 2019, grandparents saying that their primary reason for caregiving for their grandchild is that the child's parents were misusing substances. So that nearly doubled between 2002 and 2019. And we also know right at that time was what is referred to as the opioid epidemic. So overuse, overprescription of prescription opioids that really resulted in a lot of addiction problems for individuals and families. So and we also know between that same period, so 2002 to 2019, the percentage of grandfamilies reporting formal child welfare system involvement jumped from 10% to almost 30%. So I think that also kind of alludes to the increased scrutiny or increased surveillance of substance use, maybe criminal system contact, things that are leading to the formal child welfare system getting involved, and then maybe grandparents stepping in as caregivers. So we know that those two things are going on. And then lastly, there were researchers that combined data from the CDC and from the census, and found that the states with the highest percentages of grandfamilies are also the states with the highest opioid prescribing rates, again, mostly from the early 2000s to the late 2010s. So again, kind of piecing all this together, we can kind of see that the opioid epidemic really did increase the number of grandparents who are raising grandchildren. So again, those observations aren't coming from a single data source, but really kind of thinking about how do we combine these different numbers from different places to kind of learn more about what might be going on. And then again, I think places like this is where it's even more critical to talk to folks that have that lived experience. So I mean, I can, as a researcher, as not having been, a grandparent raising a grandchild, I can look at these things and say like, okay, I think some of this might be what's going on. And then someone with that lived experience can look at it and really say like, oh, okay, but like here, I've been talking to lots of people that are also raising grandchildren. Here's what's going on. Here's what happened with me. Here are some other things we should be asking to kind of learn more about this, and other issues maybe that are happening at the same time. So would love to hear Norma's thoughts on this one too.
Well, I think the slide says it all. I mean, think about this, 1.6 million in 2014. That was actually the year that I got my grandkids. And then just look how things have escalated, in the amount of time to 2022. I mean, 2.5 million. And I think the number is just going to continue to climb. And I think that's just me personally, that is again why we need more emphasis on what are the supports that are out there for these kids when they're placed with family, placed with friends, to make sure that we're doing right by these kids and we're giving them every possible opportunity to thrive, and not drain the resources of their caregivers to the point that then they're reliant on the system, in the last part of their life. I think it's about getting this right. But we have an opioid crisis. Kentucky is one of those that have higher percentages, and I think that this kind of data just brings it all together about why we got to do more.
Thank you. We can go ahead and move to the next slide. I think that's the end of the formal presentation, the formal slides. So we have some time we have about 25 more minutes in our hour together. So we have time for discussion. I know folks have been putting things in the chat. And then we've also pulled up some websites to kind of give some examples of places where you can find pieces of information that you're interested in, topics you're interested in, thinking about, how to find data for your community, your state. So happy to go through a brief overview. Also happy to take specific requests in the chat to look up specific things here together. And then all of these resources will be shared with you all via email with the recording of the webinar afterwards too. So if you don't think of something that you want to look up during the webinar, you'll have the links, and also we're happy to follow up and be helpful. So I'll go ahead and pass it over to Anna, who will tell us how we're going to handle this next part.
Thank you, Brittany. And Thank you, Norma, and I'll get myself off camera there, on camera again. Such a great presentation and so many great data resources. I mean, there's still a lot that we don't know, but the more that we do know, I agree with Norma, the more reform and change and can happen. You will see in the chat, Brittany, that George Gable asked a question about the specific data sources that you talked about, and if you know of any of those that were co-designed with those with lived experience.
Yeah, thanks. I know George and I, along with another colleague that Norma knows, Sandra, Colette from New York, we co-authored something on, encouraging funders to support researchers and partnering with folks with lived experience. So glad to have you here, George. I think, I mean, you're pointing out a huge opportunity. I was going to say gap, but I'll say opportunity for the research community to really think more about how to, co-design future studies. I mean, these resources definitely, but the studies themselves, like I said, I as a researcher, I can kind of look at things and say, okay, this might be an interesting question. This is an interesting question. But in terms of figuring out what are the critical questions to answer, and then how do we ask folks these questions in a useful way, in a respectful way, in a way that's getting at what folks really need and want to know. Like, I think I can't do that without folks like Norma. Like as a researcher, if I want to study a particular issue related to kinship and grandfamilies, like I wouldn't, I wouldn't know where to start really. So I think it makes total sense for researchers to be partnering with folks with lived experience on things. And I know that Norma feels strongly about that as well. But I guess I can't point to a specific resource that has been co-designed, but I appreciate the reminder that we all should, be pushing funders and researchers to do that more.
And I do think a lot of programs too that are collecting outcome data on their programs, on what they're doing. They ask the caregivers how to frame the questions, what's important to them. So it might not be to the level of fancy research, but research that we can all delve into. But certainly at the programmatic level, I think this goes on a fair amount and should go on more. And I did drop a resource in the chat about how to engage those with lived experience in the work and how to compensate them and really honor their contributions because they are fundamental. Brittany, I think we don't have too many questions, so I think it would be really useful to share some of those websites and just kind of walk us through users, those of us who are non-data folks, on how we can access, especially like community-specific information too.
Yeah, sure thing. All right, so I'm going to share my screen and I'll walk through a couple of things, and then if there's a place where you want me to stop or slow down or to do anything specific, Norma, Anna, totally interrupt me, and folks feel free to drop stuff in the chat. So I'm starting here with the Kids Count Data Center. So this is coordinated and put together by the Annie E. Casey Foundation, and this is a really cool interactive data tool. So this pretty easy to use map. So we can click on, let's say, Kentucky, where Norma is, and it'll take a second to load because it's pulling a lot of data together. So you can look specifically by county. So this is just, overall Kentucky. I can do this at the US level too, but just thinking about state level. So Kentucky, county, school district, city, congressional district, these might be the kind of talking points if you're going to meet with one of your elected representatives and you want to be able to bring them data from their congressional district. And then you can choose by topic. So, there are groups of topics, economic well-being, COVID-19 specific information, family and community. You can look at different characteristics of families and children. So let's say we can, let's pick a topic, I guess. This is pulling from, I should also say, from the census data. It's pulling from the APGAR, so adoption and foster care data. It pulls also from NCANS, the National Child Abuse and Neglect Data System. So it's pulling from a lot of different things. Let's see if we can find, I can't remember where the kinship caregiver ones, I should have pulled one of those up to begin with. But this is just the main data page is why there's so much. So let's see, specific academic performance variables, so fourth graders reading scores. And you can look at, again, this is, from, looks like 2007. I don't know why these aren't in order. That's not helpful. 2003 to 2022. And so you can kind of look at, what's going on in different years. This is just again, an example. And then if we want, we can be more specific with, different trends, and we can also be more specific with some of the family characteristics of those kids if we want to look in that level of detail. So, kinship care versus foster care versus not in foster care. Sometimes depending on what you specifically want to look at. So actually I pulled this one, which is maybe a good example of a limitation. That sometimes depending on where the data are pulled from, the website doesn't have the functionality to compare every single piece of information from every single data set with every other piece of information from every other data set. So for sometimes something really detailed like these reading scores might not necessarily be linked to whether or not they're in kinship care, and then if so, what kind of kinship care they're in. So that's something to think about. But for the most part, with broader things, the kids count data can be really useful. And then you can also search if you don't want to go into the, what I just did in terms of all the detailed stuff by topic. We can go to, let's see, I think they have a family structure. So this is grouped by their big topics. And we can click there. It'll take a minute to load. So here's a good, children in kinship care. So we can look at trends. This will show us 2017 to 2019. And if you want, there you go, by state, you can kind of select the different. So if you just want to know for the past 2 years, we could get rid of all of those. This is for every state. If we want to just look at the nation, we can switch to that. And then we can look at trends over time. It's thinking today. And you can really use this tool to create a lot of really cool maps, trends, bar graphs, kind of whatever you're interested in. And then you can also create a custom report, which is, a more advanced tool where you can say, okay, I want, this specific territory or my specific city, and then specific pieces of information that you're interested in, and then it'll spit it out for you in a different file format. So lots of different options there to play with. I would say it's not the most user-friendly, just in terms of, a lot of different options. If you really get into it, like I did with that last example, but if you stick with the kind of big, these big tabs of bigger bucket things, I think it is pretty user-friendly. And again, super happy to share my email and be helpful for folks that are trying to find something more specific on this. Okay, so this next one is from Child Trends. So this is state level data for understanding child welfare in the US. And this is a cool tool that's been put together by some colleagues at Child Trends on these different 5 indicators. So, maltreatment, foster care, permanency, older youth in care, and then kinship caregiving. So if we do Kentucky, kinship caregiving, and scroll down, this website will kind of give you, looks like for the past 5-ish years, data from over time, again, in numbers of and percentages of children in foster care placed with relatives, other information. So average length of time living with the relative they're living with now, grandparents specifically. We can look at race and ethnicity, age, and then it'll also give you, your state compared to the rest of the country. So quick examples of if you just kind of want to think about how your state compares with the rest of the country. And also data on, exiting kinship care and kind of what are when those situations end, where are kids going. And yeah, so just kind of lots of different little fun tidbits at a really quick little resource. And again, that's available for all of these different indicators for all of these different states and Puerto Rico as well. All right. This next one is, so the census data, which I think can be really overwhelming. And there's totally like lots of fun rabbit holes to get stuck in here. But if you go to the census website, so by topic, you can pick different topics that you might be interested in. So I selected families and living arrangements. So families and household data. And these are tables that have already kind of been made by some of the scientists at the census. They think like, oh, folks may be interested in these, little tidbits of information. So these are kind of pre-made. Lots of different information. You might not necessarily need all of it, but you can download lots of different, data documentation if you were going to really use this to do some analyses. And if you wanted something more like, oh, I'm just looking for the number, they actually just data.census.gov has a new navigating tool that's pretty interesting. So we can type in like grandparents in Kentucky, almost like a Google search, and then it'll pull up all the different tables. So that's just like where they've kind of compiled some of the information for you that are related to these topics. So if we, let's see, so this is grandchildren under 18, living with a grandparent who's the head of the house. These are broken down into really more specific things sometimes. So this is also like gonna divide up by like age of grandchildren. If we want to just think about like grandparents more broadly, we can go with one of these top, or grandchildren more broadly, we could go with that one. And then it'll give you the different aggregation of data from, it looks like they're going back to 2010 to 2022 is the most recent. And then a really quick note, these 1 year versus 5 year estimates, there's so the 1 year estimates are just the most recent information we have, but it's only taking into account information collected in that 1 year. The 5 year estimates are, again, where the statisticians have done some fancy math to be able to show you information from all these 5 years kind of in these single estimates, kind of fill in gaps using data collected from all 5 years to make estimates about 1 year to kind of fill in missing data. So it might be more complete, but it's also less recent because it's factoring in things from longer ago. More information than I think I need for most of my uses. So hopefully just the 1 year estimates will also be helpful for you. I just wanted to point that out because it is confusing. One of the links that I shared with Anna and Melissa that will be shared afterwards is a quick explainer from the census about when to use the 1 year versus 5 year estimates if folks are interested in that.
Thank you, Brittany.
Yeah.
I can't speak for everyone, but it's making me a little dizzy. So I thought maybe we'll give a little pause here for
Yeah.
scrolling. But I did want to let people know that with the Census Bureau, there is a report that they prepared in 2014 on grandparents living with grandchildren and grandparents who are the custodial, who are raising the grandkids. And they have updated that, and we are waiting for its release. I just talked to the Census Bureau. That should come out soon. They are also doing a poster on American Indian Alaska Native grandparents and grandchildren, and that will definitely be released in mid-April, and it will be available on the Census website. So those are two things. And then, for some of the things that Brittany was elevating for us non-data folks, I think that our landing page on the network website can be helpful because it's kind of basic about how to walk through a little bit of it. Also, I'm drawing Generations United does a State of Grandfamilies report. And every year they take that Annie E. Casey data. And so there's one set of tables that's about children in kinship care. So that's what we're calling the informal, the whole universe. And then there's another set about the children that are in kinship foster care. And so that table on page 57, 58 has it for each state and for national. So that can be helpful to kind of just a real easy, fun place to find it. So I thought I'd elevate that too.
Yeah,
Is
thank
there
you.
another data source that you would like to elevate, Brittany?
Yeah, thank you. The network's data page is super helpful and actually has explanations of some of these different census tables that I was showing in class. They kind of explain kind of where you can find which pieces of information, and it's written out. So that one won't make you dizzy. Hopefully you could scroll at your own pace. This just as a quick example, I'll just share one more time. And this is the main census table for grandparents. So I had specifically said Kentucky. So the two so it's pulling up this grandparents chunk of data for me for 2022, the most recent, and just for Kentucky. So here it'll say usually at the top is always the whole, like that'll be the biggest number you see, the whole population. So it seems like there are 93,000 in 2022 grandparents who are living with their own grandchildren who are under 18 in Kentucky. And then you can look specifically by, different populations you might be interested in. So in Kentucky, almost 9% of those grandparents identify as Black or African American. You can look at the breakdown. So 2/3 of them are women, married versus unmarried, working. And this has been an interesting one to look at over time. The percentage of grandparents, who are working versus not working. And you can look at, historical data. Again, I could add another year to this and say like, oh, let's look at how has that changed in the last, 20 years. 5% of these grandparents living with grandkids say that they were born in another country. So again, might, just kind of think about some of the specific things that folks might need in terms of, maybe resources in another language, things like that. I will stop sharing there, but just an example again of some of the specific things you can find. Norma, do you have anything you want to add about data sources, data places to look? No worries if not.
Yeah, and if
No.
you scroll over on that last page that you just shared, it'll show also percent of grandparents responsible for grandchildren. And it breaks them down into 2 age categories too. I often find that data helpful as well. Sorry, Norma, go ahead.
Oh, no, no, I think that's great. I just wanted to say, I mean, these are great data sources. And I think, depending on where you live and what it is that you're trying to do on behalf of these families, it's just great data to pull. And it's no surprise when I look at this stuff, living it, it's no surprise, the data that you presented.
Thank you.
And I see a question here from Dorothy Sanders about the grandparents living with. Yeah,
You're right.
that's the broader population. But if you scroll over and see grandparents responsible for the percent, yeah, that one is
Yep.
what we use to mean grandparents raising.
Yes. Yeah. Great catch. Thank you. So yeah, this is all grandparents who say I live with a grandchild who's under 18. And then if we scroll over a little bit, it's the percentage of folks who say, and I'm primarily responsible for that child that lives here. So it looks like 50,000 of the 93,000 grandparents living with grandchildren are responsible. And then there you can scroll down and look a little bit more. So let's say here where we looked earlier, almost 9% of grandparents living with grandchildren identify as African American or Black, almost 11% though in the group of folks who are responsible. So that's comparing like things like that between those 2 categories is where you can also start to learn about disproportionality. So we can look at things like that. We can also look at, looks like a slightly higher percentage of grandparents who are responsible for the grandchild they live with are still in the workforce. So 44.8% versus 46.1%. Not a huge difference there, but sometimes when you look at these categories, there is a really big difference. And so that, those places might point out, again, disproportionality in places that we should be looking at, thinking about in terms of equity and resources that folks might need and populations that need to be reached. It's a lot of really cool, ways to kind of scroll around and find what you're interested in. Once you get the hang of some of these tables, I think they're really, they can be really helpful, but again, can also be, kind of intimidating or just more information than you want. So again, super happy to share my contact information and be helpful if folks have specific questions.
Thank you, Brittany, and thank you, Norma. And I will say too that, that last table, it's self-reported data. So how one grandparent may feel that they're responsible might be different from how another grandparent feels they're responsible. And also the Census Bureau doesn't consider great-grandparents as grandparents. They consider them as other relatives. So there are all these kind of, caveats with this data, just to be aware of. Teresa pointed out that people might be interested if you could talk a little more about the trending age of kinship caregivers over the decades.
Yeah, I am definitely not an expert on that front. I think it's kind of multiple things are happening. I think that, folks are like in general, the age of the US, population, like the average age of folks is getting older. So the generation of folks who are grandparents right now, the baby boom generation, that was like a larger, generation. And also now like folks in like my generation are having fewer children. So I think that it generally just means the average age of folks is older. So as there are more folks taking on the role of a grandparent caregiver. It might just mean that the average age there is older. But also, like you said, you're right that there are younger folks who are stepping into those roles. And some of that might just be an evolving understanding of who could be a kinship caregiver. So thinking about siblings, aunts, uncles, things like that, fictive kin. So I think that might just be a good example of where we should dive into more specific trends within that bigger trend to kind of learn about, like it might not be useful just to think about one average age of caregiver over time. It might be, okay, and what's going on specifically with caregivers who are getting older, but also now we've got this new population of younger caregivers. And maybe if you look at all of it as one data point, it kind of evens out. But if we look at more specific things, we realize, oh, there's two different things going on here that we can pay attention to. That would be my 2 cents. I'm definitely not an expert on that part of it, but it's a good question. Thank you.
Yeah, and Brittany has shared her email, but also know that we can access Brittany through our technical assistance form, which the team is going to drop in the chat. So if you just have a data question, we may be able to answer it in-house. And if not, we luckily are partners with Child Trends, so have access to Brittany and other folks who can likely get you the answer. So please do reach out. It's probably better if you don't mind using the form, because that way we can track it.
Definitely.
But of course, Brittany is graciously offered to help.
No, that makes sense. Using the form for the network makes a ton of sense, because if you have that question, chances are someone else does too. And so if we share the information with Anna in the network, then it'll go to you, the folks who ask for it, but also we can share it more broadly. So looking forward to hearing from Anna any requests or questions that you all have.
Yeah, and we're just happy to hear from people who need our help. So honestly, any way you reach out to us or reach out to Brittany, we're happy. So we're here for you all to make your jobs easier, hopefully. So we've dropped a chat. If you don't mind taking a minute, it's a short, a survey, not a chat. We've dropped a survey in the chat that Child Trends actually developed. If you don't mind answering that real quick. And then, any questions? The form has been dropped in the chat, and we just really appreciate you, Brittany, and you, Norma, joining us today and sharing your wisdom and your expertise, and just very much appreciate it. We have a webinar coming up next month on some of the exemplary kinship programs that we've designated around the country as part of an ongoing process. So please join us on March 19th for that. And as I say, please follow us on LinkedIn. Please just stay connected. We're here for you. So thank you again, Brittany and Norma, and all of you for joining us.
Thank you.